Welcome to the Deflux for VUR YouTube channel. I'm Carrie Red, Training and Education Lead for Palette Life Sciences. Today, we're joined by my friend, Hal Scherz.
Thank you, Carrie. I wanted to thank you and Palette Life Sciences for allowing me to be a part of this educational series for parents. As we conclude this series, I wanted to be able to present to the parents the eBook for Deflux, and for everybody who has tuned in to this entire series, this will be more or less a review or a final exam on what we've already talked about. So let me just quickly run through our eBook and go through the high points. And this is something that people can download on the Deflux website. So let me share my screen. So this is our the Deflux overview for caregivers. And the first slide just gives an overview about what reflux is, which is backflow of urine going from the bladder up to the kidneys, and why this is important, because it's the most common reason why children get urinary tract infections. And the upper part shows normal flow of urine from the kidneys into the bladder, but in children with reflux, urine goes down the ureter and then goes back up to the kidneys, and the kidneys get infected. When reflux is diagnosed or suspected, the children really should see a pediatric urologist. And we spent an entire episode in this series talking about what a pediatric urologist is and why it's so important for your children to have a pediatric urologist overseeing their care when it comes to matters that involve the genitourinary tract. Testing for reflux involves doing a voiding cystourethrogram, or VCUG. So whenever we suspect that reflux is the reason why a child gets a urinary tract infection with fever, we send them to the radiology department to get a voiding cystourethrogram. There are other ways of diagnosing reflux other than the voiding cystourethrogram, such as a nuclear cystogram, but the voiding cystourethrogram is the only way that we can reliably give the reflux a grade and assess other factors, such as the timing of reflux, which is very important in creating a treatment plan for your child, because the timing of reflux and the grade of the reflux are both factors that give us a idea whether or not we can reliably expect the reflux to resolve on its own in time, or intervention will be necessary. If intervention is necessary, there are several different ways of doing that. But when we diagnose reflux in children, we can either monitor the problem, either on or off antibiotics. Very few children fall into the category of just watching them off antibiotics because they're at risk for more infections. Most children who we watch are kept on antibiotics, and we continue them on antibiotic prophylaxis, which is a small amount of antibiotic every day, until we feel that it is safe to stop the antibiotic, either because the reflux is gone or it is insignificant, or we've gone ahead and intervened. And intervention means either surgically correcting the reflux with an open or laparoscopic or robotic surgery, or a much less invasive way of correcting the reflux is endoscopic treatment with deflux injection through a small telescope that we put up the urethra, and introduce the deflux under the ureters through a small needle stick under the ureters. So we've talked already in this series about what deflux is. It's a complex sugar. It's inert. It does not interact with the body, and it's got a long track record. It's been used for well over 20 years in the United States, longer than that internationally, and it's been used in other areas of the body in different types of applications, but the same material, in ophthalmology, in dermatology or plastic surgery, and in orthopedic surgery. Deflux is a procedure that has a very high success rate, and it's comparable to open surgery in the hands of people who are in doing the Deflux injections as has been described in the literature with the double hit technique, which my group has publicized, and with a reasonable amount of volume, which is an important factor as well in the success of the procedure. More importantly, the acceptance by parents is exceptionally high. Why is that? Because we can correct the reflux as an outpatient procedure with a minimally invasive treatment that does not require any kind of invasiveness, no cutting, and it is a procedure that allows the children to go back to school the next day and the parents to go back to work the next day. And it is not only successful in the correction of reflux, but also in the reduction in both febrile and afebrile urinary tract infections following Deflux implantation. So if you want more information about your child who has reflux and you're interested in Deflux, it's if your pediatric urologist is unable to give you those answers, then you can easily get them on the Deflux website, clicking on the Find a Doctor tab, and that will connect you with a pediatric urologist near you who is comfortable and experienced with Deflux. So I encourage all parents to investigate and check this site out and get more information than we've already talked about in this short segment, but we've covered in previous segments. And with that, I'm going to leave us with the final slide, which is learning more about Deflux at deflux.com. I'll stop sharing my slides in just a moment. I just wanted to once again thank all the parents who've tuned into this series. I'd like to thank Palate Life Sciences and our moderator for this series, Carrie Red.
Anyone who wants more information about Deflux, they can go to deflux.com, and at deflux.com on the patients and caregiver side of our website, there is the Find a Doctor tab where you can find a doctor in your area. Just enable location services on your computer or your mobile phone, and it will clue you into the closest pediatric urologist to your location who offers Deflux. And then there's more information you can access about the condition of vesicoureteral reflux. And you can also download that ebook here. We also have a Facebook page for Deflux, so you can look us up there in social media as well as on Twitter. Once again, Dr. Scherz, thank you for providing such great information and sharing your knowledge with us. We thank all of our viewers for tuning in. Have a great day.